missing teeth and thinking whether to undergo implants or bridges, then this video will definitely solve a lot of your doubts. Now in a bridge, in very simple terms, to replace a missing tooth, we take support of the adjacent teeth, shape them up, that is grind away part of the tooth structure and then connect them. So for a single missing tooth, you make a 3-unit bridge. For multiple missing teeth, you have to shape up multiple adjacent teeth, use them as pillars and then make a bigger bridge. Whereas in an implant, to replace the missing tooth, we take support of the underlying bone. So a screw-like material is drilled into the bone and then over which you have a crown. So every tooth is independent of each other. Now what are the advantages of a bridge? Number one, it is cost effective compared to that of an implant. Number two, it is a non-surgical procedure. So if you are in any phase of life, for example, you are undergoing some chemotherapy or radiation therapy and do not want any kind of surgery, then bridges are definitely a good option for you. What are the disadvantages? Primary, you have to grind away part of the healthy tooth structure. Secondly, if your adjacent teeth are not healthy or they have some decay or they are mobile, they are having some gum issues, then first you need to sort that before using them as pillars. Number three, when you are connecting them together, if in future there is problem with even any single tooth, then the entire 3-unit could be at stake. Fourthly, if you have the last tooth missing, then giving a bridge is not a very good idea because generally you need a pillar in the front and a pillar behind to make a strong bridge. If you have only front teeth, then it becomes a cantilever design for which the prognosis of your bridge is always a question mark. That means the longevity of the bridge is a question mark. Let's talk about the advantages of an implant. Primary being no grinding of the adjacent teeth, so we are not touching them at all. We are just making use of the underlying bone. Now what if your bone is resolved? In 95 to 98% of the cases, with the latest basal implant technologies, we do not need to do any kind of bone grafting because generally it's the upper bone, the calcaneus bone, which dissolves. But the basal bone, the base of the bone, that is the cortical bone, always remains, and basal implants are put in the cortical bone. Now medical conditions, whether you have diabetes, thyroid, blood pressure, any kind of heart issues, of course after doing a certain blood tests, and if your range is within a particular limit, implants can be easily done. Age is also no bar. We have done implants in patients above the age of 80 years also because they have ill-fitting dentures, they are unable to chew well and have other digestive problems and other problems, and now they want some fixed prosthesis. So implants is a good option for them as well. The time taken is same as that for bridges. Day one, we put implants, take impression, and after a few trials, by the 4th or the 7th day, you get your final prosthesis over which you can chew. Disadvantage number one, it is costly as compared to that of bridges, but now with EMI options available, and at our clinic we also have a zero interest EMI option available, so more and more patients are thinking about implants. Secondly, of course, it is a little surgical procedure, but unlike the previous days when we used to give a cut, open the flap, place the implants, give sutures, nothing like it is done now. In most of the cases, it is a keyhole surgery, a very minute hole is made and the implants are put directly. So these are the advantages and the disadvantages of implants versus bridge. You can think over it and then decide.